Today, we will be discussing measuring your blood sugar using a glucometer. Glucometers use a tiny drop of blood from your finger to measure blood sugar. The glucometer used most often at Legacy Community Health is the Glucocard Shine. Each glucometer is different, and they all generally require different test strips. So be sure to only use the glucose test strips that are meant to be used with your glucometer. To test your blood sugar, you will need a glucometer, a lancing device, and glucose test strips. Be sure to keep your glucose testing strips in the container they came in, and keep the container closed when you are not using it. Test strips that get wet or exposed to air for too long may not work as well. Before using your glucometer, it is very important to wash your hands with soap and water or use an alcohol swab to clean the area where you will obtain the blood sample, as this will keep dirt, bacteria, or sugar from impacting the sample. It is very important that the hands are dried before touching test strips or performing testing. Insert a test strip into the machine, and be sure to enter the black side with the tip that looks like a computer chip into the machine. Once inserted, the screen will turn on. If it does not turn on automatically, this means the strip is not inserted correctly. The glucometer will stay on for more than a minute after inserting the glucose test strip. If the machine turns off before you have delivered the test strip, remove the test strip and reinsert. Next, we will load, adjust, and use the lancing device. To load the device, hold the device with one hand while unscrewing the top with the other hand in a counterclockwise motion. Next, obtain a new lancet. It's important to use a new lancet for each drop of blood collected. Insert the bottom of the lancet into the lancet holder of the lancing device. Firmly push the lancet into the lancing device holder. Twist the circular protective cap off of the lancet. And last, replace the cap onto the lancing device and screw clockwise snugly. To adjust, hold the lancing device in one hand while spinning the see-through cap of the lancing device. The numbers present on the see-through cap are the depth of the needle into the skin. A 1 or a 2 would be a lighter prick, and those with thick or calloused hands may need a 4 or 5. I usually start with a 3. The number you select should line up with the arrow indicator. Using the device, pull down the end of the lancing device. This pulls the needle back. Next, select the side of the finger rather than right in the middle of the finger pad to reduce pain associated with the prick. Next, firmly place the lancing device against the finger location desired. Press the button on the lancing device. Gently milk the finger from the base of the finger if required to obtain a drop of blood. Using the glucometer, place the end of the strip to the drop of blood. The test strip should absorb some of the blood, and you will hear the machine beep. The glucometer will then report your current glucose reading. What is a normal blood glucose reading? Before a meal, the goal is to have your level between 80 and 130. 1 to 2 hours after a meal, your blood glucose should be less than 180. Once a blood glucose reading is available, remove the lancet from the inside of the lancing device and place into a puncture-resistant container, such as a laundry detergent bottle, old milk jug, coffee can, or Sharps container you can purchase at a local pharmacy or online. Once these containers are full, you can tape them up and discard them into the trash or take them to a local disposal facility. Ask your medical provider about how often you should be testing your blood sugar. Morning readings without food are called fasting measurements. 2 hours after a meal is called postprandial measurements. Blood sugars less than 70 are considered to be too low. Low blood sugars may make you feel anxious, confusion, dizziness, fast heartbeat, headache, hunger or nausea, impaired vision, shakiness, sweating, or weakness. What should you do if you have low blood glucose? Follow the 15-15 rule. Eat 15 grams of fast-acting carbohydrate and wait 15 minutes. The following quantities of food equal 15 grams of carbohydrates: Recheck your blood sugar in 15 minutes. After your blood sugar is no longer below 70, have a small meal with protein and carbohydrates. Now you can safely and accurately measure your blood sugar. Ask your Legacy Community Health provider or pharmacist any additional questions you may have.